Cameron, here at Aspen Dental, when somebody comes in and they say to you, you know what, I've had enough of my teeth, and you were just saying you've had people as young as 20 say this, which is pretty horrific, up to, you know, fairly old people. Your first reaction is going to be, all right, well, okay, yes, we can put that on the back burner, but first of all, let's do everything that we can to try and save these teeth. That's the immediate response.
Absolutely. I mean, as dentists, we know best what's savable and what's not.
Right.
And, you know, sometimes you're right, it may be that tooth isn't savable, but sometimes it's very savable. It's just, we just need to talk through the process. You may have heard things, and let us help you understand what would be in your best interest with the teeth that we can still save.
Well, a little counselling goes a long way, even if it is with dentistry, right?
Absolutely.
So, but having said that, so first of all, of course, you're going to try and save everything that you can. But every now and then you are going to have somebody who, A, does need all the teeth extracting for whatever reason, medical or whatever. Or B, you've got somebody who has had them all extracted and now they already have dentures. What are the options for these people? Because eating, as far as I can remember from my own, you know, elderly grandparents, eating with dentures is not always easy.
Yeah, I mean, there are some people that have gotten used to it and are very happy, and we're thrilled when that happens.
Right.
But more often than not, there's at least one of the two dentures that doesn't stay in place, and particularly with men, they just don't wear them.
Oh dear.
Because if they're not going to fit, they just don't wear them, and they learn to eat without them. But they have to adapt, and so they have to overcome it. So, yes, there are options, if they're missing...
It's not 50 years ago when you just had a bit of glue to throw at them. Nowadays, you do have things, don't you? Implants, for example.
Yeah, absolutely. So the whole reason why the dentures don't stay in place is because your mouth has, your cheeks, your tongue, everything moves, and you're trying to get a piece of plastic, and it's nicer than that, but you know, a hockey puck to stay in your mouth. You know, it's not a simple task.
Right.
So the best solution is to get at least a couple implants. You know, 2 is the minimum, more is better, but they act as an anchor. It's put down there in the bone, and they support it. So it basically almost locks in at the most basic level, locks onto those, and they stay in. They don't bounce, they don't slide, they don't shift, and you can actually get some decent force, because now when you're chewing, your bone and all your muscles are behind it instead of just the denture on denture, which we've seen is you've got about less than half of your chewing capacity than when you had teeth.
Okay.
So
unlike other, we've talked about other kinds of implants, these are specifically for dentures or partial dentures that you put in your mouth and you attach the denture to them. And they're not creating that friction or movement that you had before.
Right, they may be the same kind of implants, but they attach to the denture
as an anchor.
As an anchor to lock it in place. I mean, they literally like snap in sometimes, and so that's the best way to go. And when we have people, I mean, we've had people that have been in dentures for 20 years and have felt happy about them, but then just said, hey, well, what are my options? And when we have done the implants and ask them, how's the difference? Oh, it's amazing. I can eat a carrot again. I haven't eaten a carrot in 20 years. And it's just,
then they're really happy.
Yeah, you get a part of your life back. You can eat all the stuff that you couldn't eat before.
Right.
You know, so it's a definite advantage, and it can get even better from there. You can even have dentures that are literally fixed in there and they never come out. I mean, you can go that far, but at least stabilizing the denture, it makes a world of a difference in the ability to chew, to go eat out with friends and not be worried that it's going to fall out, or something else that's just kind of humiliating. Right. You know, and so it definitely improves the quality of life.
And also I'm thinking, I remember with my own grandmother that she used to get pieces of, it's pretty gross, but I mean, it's life, right? You're going to get pieces of food stuck underneath. That could cause all kinds of problems.
Yeah, so the more stable they are, the better you're going to get. And you know, I often even think of it from a nutrition standpoint. That's what I studied in college. The better you can eat, the better you're going to stay healthy. And so if you're having to eliminate a lot of foods just because of how your teeth are, then that's a detriment to your health. If we can help you so you can eat those vegetables and those fruits or whatever it is that you avoid because of the dentures, I think that's a huge win. Not just for your smile or your pride, but for your whole body.
For your health. Yeah. And that in itself has got to be huge. Is it just a regular appointment? How long does this kind of thing take to... Because, I mean, you see on the television all the time, people say, oh, well, you can have new dentures in one day. I don't think I believe that, should I?
There are cases when it can happen. I mean, depending on your personal situation, that we may be able to put a few in, and you can use the denture you have, we can modify it, and you can use it that day or pretty quick.
Right.
Other cases, if there's other things needed, that's not wise. We want to make sure the implant is solid.
Right.
Because if we start chewing on it too soon, it might fail, and that's a hassle. It's
Right.
more expensive. So we'd advise each person on an individual basis, based on their situation, if there needs to be a wait time, how long that might need to be.
Right.
Because we want to make sure that you do it right the first time, and then you're done.
Yeah. As with everything in life, let's do it right the first time. So when you come in here to Aspen Dental and see Dr. Cameron and all the dentists and the staff here, they're not going to make empty, really quite stupid promises. You're going to come in here, you're going to get an evaluation, you're going to get counselling on what you need for your specific situation, and really an honest opinion. You're not out here just, going, here's somebody coming in, let's make thousands on this person. That's not happening. People come in here and you deal with them honestly.
Well, yeah, I mean, we treat you as if you're part of our family.
Right.
We're going to do something, we want it to last. We want you to be part of our family for as long as you're living here. I mean, we want you to be comfortable, and we're going to be the ones that follow up and take care of what we do.
Right.
So we want to make sure it's right.
Yeah. So just a great place. Should you find that you need something like this, and people do, either old or young, sometimes you're going to need this kind of procedure, come into Aspen Dental and see Dr. Cameron. How do we get a hold of you?
So just give us a call at 753-4400 or visit our website, aspendds.com, whatever's easier for you, and we'll get you started.
They will get you started. They'll also get you taken care of and finished. Just a wonderful place to get these problems taken care of. Thanks, Dr. Cameron.
Thank you.